I'm Beverly Braswell, and I'm doing our video for Issues and Trends in Healthcare. I will be interviewing Kathy Struve. She's supervisor in our laboratory here at Texas Health Resources Southwest. Kathy, what is your role as a supervisor?
As a laboratory supervisor, my primary responsibilities are for laboratory information systems and client services, including billing.
Okay. What are your key responsibilities?
My key responsibilities include ensuring that the laboratory information system is correctly configured. We maintain compliance with regulatory agencies, and I set up all of the billing files to ensure that patient billing is done correctly.
Okay. What happens when you have a bill that you found to have been charged twice?
Well, we perform random audits to ensure that billing is correct. Once we find an error, we are required to report that to the CBO, which is the Central Business Office. Once we've reported the error, the CBO will determine if incorrect billing occurred, and if so, then they'll send out a corrected bill and rebill the patient or send a credit as appropriate.
Okay. Let's say when we have a specimen and there's a special stain done, if it's on, we do a GMS on a block A1, and then we turn around and we decide, well, we want a block A7, same specimen, same patient. Can we bill for both of those special stains?
In most cases, no. The patient wouldn't be responsible for what work it requires to get to the final answer. There are some cases where it's appropriate to bill for the same test twice, but each situation is unique. There are very strict guidelines according to Medicare and insurance companies for what you can and can't bill for. So in most instances, no, you would not want to bill the patient twice for the same test on the same specimen.
Okay. What happens if you discover that a test wasn't billed?
We are also required to bill for tests. We're not allowed to do any work for free. There are actually laws governing that. It's the Stark law, meaning that if we bill one patient for a test, we have to bill everybody for the test. So you would think that missing charges would be a good thing for the patient, but actually it's not. It could be considered fraud and abuse. Therefore, if we find missing charges, we will manually bill the patient, or we will submit that billing to the CBO. They'll evaluate whether or not it needs to be billed to the patient and send a corrected bill if needed.
Okay. I'm a laboratory employee. Can I get a test done for free?
Absolutely not. Nobody gets any testing for free. As I stated before, the Stark laws require that if we do a test on a patient, that test must be billed for. Nobody gets anything for free.
Okay, well, thank you for your time. What I've learned from what Kathy has told me is that she has a lot of responsibility here at Texas Health Resources. She's explained how to handle duplicate charges, charges that were never billed, some charges that appear billable but maybe really they aren't. I will be able to use everything and anything that Kathy's helped me with here in my role as a supervisor over the histology department. I perform billing also as part of my job, but then again I have Kathy that backs me up, which is reassuring to me. I have to sometimes I have to go back and do correcting on billing if I bring it to Kathy and Kathy says it doesn't look right, just so that we're in line with the laws and regulations. So that's really Kathy's true role, and that's what I learned from her. Things that I learn right now in this instance is going to help me far into the future. I should be able to handle billing a lot better as time goes on and more in my career. I would like to thank you, Kathy, for your time and all that you do for me and what you do for Texas Health Resources. Thank you.
You're welcome. Thank you.